Yes. Hey, hi. How you doing?
Mr. S. Hi, I'm Sharita Carter.
How
Let me
are
just
you?
Good to meet you. Let me just wash my hands real quick here. Good to meet you.
Very nice to meet you.
I am a family nurse practitioner student, and I am going to inquire about what brought you in today. Okay. So, can you tell me what brought you to the office today, Mr. S?
Well, I started out about it was a couple of days ago. Um, I was eating this. I had a cheeseburger. I remember vividly. I had a cheeseburger and French fries. Ate that, and then it was about 30 minutes after that. There was just like this intense, just like really sharp pain in my stomach, my abdominal area. Um, and it kind of lasted for about an hour. But it was real sharp. It was pretty painful. And then so like that was a couple of days ago, and then today like the pain is back,
Okay.
and it's like it's even worse. Like I mean it's pretty unbearable. It's even worse than it was before.
Okay. Okay. So you had this pain a couple of days ago. After you ate a cheeseburger and fries.
Yes, ma'am.
About You said maybe about 30 minutes after you ate.
Yeah, it's about 30 minutes. About 30 minutes after I ate.
And then the pain returned.
Yes.
How long ago have you been having it now? Would you say? When did it start?
It's been I think at least it's been a couple hours.
Okay. Okay. Now, can you point to me where the pain is exactly?
It's like right in here.
Okay. And does that pain come and go, or is it kind of a constant?
Well, when it first happened, it was real sharp, and then it went away.
Okay.
But like now, it's kind of not. It's been like a couple hours.
Okay.
And it hasn't gone away at all.
And
it really hurts.
So it's unremitting. It's constant now. And would you describe it as sharp, dull, achy? How would you describe it?
I think it's a sharp,
Sharp.
sharp and yeah, intense pain.
And and have you had any nausea and vomiting with it?
No.
No. Okay. What about fever? Any fever?
No, no fever.
And is there anything that makes it better? Did you take any medication or anything?
No, I didn't take anything. I just kind of just drank some water, and I just try to kind of like I thought maybe it was like like stomach cramping.
Okay.
So I kind of just drank some water and kind of just try to lay out and stretch out a little bit.
Okay. And
I don't know. I don't know if that's what did it or when it went away the first time. Now I try to do the same thing, and it hasn't let up. It hasn't let up at all.
Nothing seems to help.
No.
Okay. Okay. Well, I am going to ask you some more questions about it, and then I'm going to get a little bit more detail about your general history, your surgical history, and we'll do some testing, and we'll get an assessment.
Okay.
We'll get things figured out for you.
Okay. Can you help me with this pain?
Yes. 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 Definitely.
All right.
How has your appetite been in general? Are you on a regular diet? Are you eating?
Yeah. You can tell, you're a big fella. I eat quite well.
Okay. Okay. So no special diet?
No.
Okay.
Steady diet of unhealthy foods, I guess.
Okay. You tend to eat a lot of high fat foods?
So, whatever's fried, kind of, cheeseburgers, hamburgers, tacos, maybe have a little bit of lettuce or something on the side, but yeah, pretty much, macaroni and cheese.
Okay. And how often do you have bowel movements?
I'm actually pretty regular. I have about a bowel movement once a day.
Okay. When was your last bowel movement?
This morning.
This morning. Okay. Have you had any recent color change or change in the consistency of your bowel movements, or any constipation, diarrhea?
Well, last couple of days, it's been a little bit harder. I'm like, it's kind of really hard. Yeah.
A little bit of
Kind of like,
constipation.
yeah, a little bit of constipation.
Do you notice any bleeding, or do your stools look really dark? Sometimes people describe it as kind of tarry.
No, nothing like that.
No. So what color are they?
That's brown.
Brown. Okay. Any hemorrhoids?
Well, no. No. I mean, this last one was pretty. It was pretty hard, so it was a little painful, but I don't think it's.
Okay. Now tell me a little bit about your past medical history. Are you allergic to anything? Any medications or foods?
No, ma'am.
And then, when was the last time you had a complete health physical?
Oh man.
By a health practitioner.
I can't remember. Yeah, it's probably been
more than a year.
It's probably been more like 5, 6.
Okay. Definitely
over 8. It's been a while.
So have you ever had an EKG? They also call it an electrocardiogram.
And what is that?
That's where they look at the electrical activity of your heart. It doesn't hurt at all.
Like so they put stuff on there.
Well, we'll do one on you. Yeah.
I've never had that.
What about dental exam? When was the last time you've seen them?
It's been about 2 or 3 years ago.
Any problems with your gums, your teeth?
Well, I had, I guess, my gums were bleeding because I haven't been flossing.
Okay.
And they had a couple little small cavities.
You're due for that exam as well. What about vision? Do you wear glasses or contacts?
I wear contacts.
And so, when's the last time that you saw an eye care?
Shoot. Well, I have to, do it every year in order to get the contacts.
Okay.
So, yeah, it's probably within a year.
Okay. Do you smoke?
No, ma'am.
Have you ever been a smoker? No. And how much caffeine do you drink every day?
I'm not really a big caffeine guy.
So you don't drink coffee?
No.
What about soda, cola?
I drink occasional soda. I mainly drink, like Gatorade and stuff like that.
Sweet drinks. And when's the last time you drank alcohol?
A couple days ago.
And how much did you drink at that time?
I guess 3, 4 beers.
Okay. Have you ever had a drinking problem?
I think so.
Okay. All right. Wonderful. And have you ever tried any street drugs, like marijuana, cocaine, amphetamines?
Like ever? Like in my life?
Ever.
Well, I mean, I experimented a little bit in high school, college, a couple of joints or something.
Nothing recently?
No.
Okay. So you're drinking, or there's no any drug use that has affected your work or your personal relationships?
No.
Oh, great. And are your immunizations up to date? As far as
That's a good question.
tetanus, diphtheria, chickenpox?
That's a good question. I'm assuming they are. It's been a while since I got a tetanus shot.
Okay. Do you know if you have a shot record?
I have a shot record. I don't know quite where that is.
Okay.
It's been
We may have to just draw some titers on you and get you up to date on that. Do you remember when your last tuberculosis skin test was?
Maybe. It's been years.
Okay. All right. And what medications do you take?
No, actually, that last question,
Mm-hmm.
I actually did get a TB shot.
Okay.
I got arrested and then probably about like 5 days in jail, and in the jail they come around and kind of force you to take they give you those shots. They give it all the
inmates.
all the people. Yeah.
And when was that?
That was in August.
August of
Yes.
last year?
Yes.
2014?
Yes.
Okay. All right. And do you take medication?
No.
Okay. Any over-the-counter medicines, aspirin, Tums, vitamins?
I mean, there's sometimes when I'm trying to work back, trying to work out, get back in shape. So, maybe I've taken an occasional ibuprofen.
Okay. For like headache or muscle
Yes.
pain or something like that.
Well, this is muscle pain.
Okay, yeah, from exercise. Yeah. And have you ever been hospitalized, Mr. S?
Like ever in life or recently?
Both, actually. We can go back to your younger years and then we can.
Well, I mean, when I was a kid, I guess almost I was playing in the refrigerator out around the back, and so I didn't know refrigerators can open. I was low and young. I didn't know if refrigerators can open. You can't open from the inside, and so a neighbor found me, and I almost had like very few amounts of oxygen left. So I was hospitalized. Well, but that wasn't it. I didn't stay all day out there. They just kept me there for several hours before I was released.
Okay.
But that was about it.
Made sure you were okay.
Yeah.
Made sure you were breathing and everything was okay. Goodness gracious, a lot more time to go through. What about recently? Any other hospitalizations?
No.
Have you ever had surgery?
No.
Do you have any chronic illnesses at all? Diabetes, thyroid problems, high blood pressure?
Well, part of the reason why I'm starting to work out is, I'm worried about that. Kind of my dad, mom, grandparents, aunts and uncles. They all, a lot of them have diabetes, high blood pressure, and high blood pressure medication. We've had a couple of strokes in our family, so that's what I'm kind of worried about now.
I'd like to ask you a little bit more about that, actually. Your dad, is he alive?
Yes.
Okay. And how old is he?
About 74, I think.
And he's a diabetic?
No.
No.
No, he's not a diabetic. My grandmother was a diabetic.
Okay.
Actually,
Your dad's mother?
yes.
Okay.
And then lost a leg to diabetes. My uncle, my dad's brother, is diabetic. Probably I think my mom's brother.
Your mom's brother.
Yes. Diabetes.
Diabetes. Yes. Now, what medical problems does your dad have?
Well, he's on high blood pressure pills.
Okay. Hypertension. He has a family history of diabetes, but he himself is not diabetic. And then what about his father? Is his father diabetic as well?
I don't know.
Okay.
I do know he died of a heart attack.
Okay. Now, tell me about your mother. How old is she?
Oh, she's 73.
Is she diabetic?
No.
Does she have high blood pressure?
She's on medication.
Any other medical problems?
Well, I think my dad has lupus.
Okay.
My mom, I think, has some. I think she got diagnosed with colon cancer, but they found it early, so she didn't have any complications.
Okay. Now, do you have any siblings?
Yes, I have two brothers.
Two brothers. And how old are they?
44 and 36, I think. Jess is.
Now, does the 36-year-old Jess, you said?
Yes.
Does he have any medical problems?
No.
And what about the 44-year-old?
No. None that I can tell.
Do you have children?
I do.
How many children?
I have two children.
And how old are they?
4 and 9.
4 and 9. And do they have any medical?
God, no.
And what do you do for a living, if I might ask?
I'm a contractor.
And any problems at work or any concerns that you have right now? Do you feel like you have appropriate support in your life, as far as if you have problems at work or emotional problems or any concerns? Do you feel like you have good support?
Yeah. Yes.
And who supports you?
My wife. My parents.
Okay. Well, it was great meeting you. And we are going to get all this in your chart, and then I'm going to come back and I'm going to get some tests ordered and do an assessment. Okay.
Okay. So is that going to help this? Are you going to do something about this pain, though?
Yes, sir.
Okay.
Yes.
All right.
I'll be right back.
Man, I hope they get something for this pain soon.